you found this video, it is probably because you or somebody you know is on an antibiotic and you are having some gastrointestinal side effects and wondering what to do about them. So let's talk about antibiotic-associated diarrhea. I'm Dr. Katrina Coulter. I am an infectious disease physician, and in that role, I prescribe antibiotics all day long. And so I get questions 10 times a day about antibiotic-associated diarrhea and what to do about it. Antibiotics are antibacterials used to treat some sort of bacterial infection in your body. Unfortunately, they are absorbed by the whole system, whether you're taking them by pill form or intravenously. They are going to go throughout your entire system, and your GI tract is lined with bacteria that are good guys. They're in there doing what they're supposed to do, but they are going to be affected as the innocent bystanders. So when you get antibiotic-associated diarrhea, it's because in addition to treating whatever bacterial infection your doctor is trying to treat, we are also disbalancing or imbalancing the bacteria in the gut. So most people on antibiotics will have some sort of GI irregularity, whether that just be loose stools or gassy bloating or full-blown diarrhea. What can you do about it? I have a few tips and tricks. The first one is that you want to avoid foods that may upset your stomach even in the best of times. So for a lot of people, this may be dairy. For some people, this may be wheat flour. Spicy foods, I would definitely go very easy on. Acidic foods also can really upset your GI tract. So you want to stick to kind of a bland, boring diet of foods you know usually don't upset your stomach. Next, you might want to consider trying what's called the BRAT diet. This is B-R-A-T. That contains foods that are high in soluble fiber, which makes like a gelatin, which kind of helps bulk up the stool. So these are going to be B for bananas, R is rice, A is applesauce, and T is toast. These are foods that generally can be used with most types of diarrhea to kind of slow down the GI tract. And on that same line, some people find a benefit from adding an over-the-counter fiber supplement, as well as some people will have improvement if they take over-the-counter anti-diarrheal medications such as loperamide, also known as Imodium. Other things that you can drink that will help are electrolyte drinks or bone broth. I have a whole video on bone broth and why it is nourishing and healing to the GI tract. And so that's one that you definitely should consider, but you want to make sure you stay hydrated and you're replacing all those electrolytes that you are losing in your stool. Probiotic pills also do help some people kind of normalize or regulate their bowel movements, or probiotic foods may also help. And so probiotic foods are going to be fermented foods. So things like pickles, sauerkraut, kimchi, also yogurt or kefir. Now, when should you be worried about that this is something more severe, such as Clostridium difficile diarrhea or C. diff, which is an infectious type of diarrhea that we do see when people are on antibiotics? And those signs that are worrisome include running a fever, having severe abdominal cramping or vomiting, getting very dehydrated to where you have a very dry mouth, or you haven't urinated all day, or if you see blood in your stool, or the diarrhea is just straight water and happening 3 or more times a day. If you have any concerns about your antibiotic-associated diarrhea, reach out to your healthcare provider for guidance on what to do next. If this was helpful, go ahead and hit like or subscribe so that you don't miss any of my other videos. And until next time.